Welcome to today's Task Force 10, where we spend 10 insightful minutes with business, community, and government leaders talking about what they're doing to adapt, to innovate, and to overcome in light of the coronavirus and the pandemic. We're grateful today to be joined by Donna Milavetz with Steward Healthcare. This is a time of high anxiety, but certainly there are things that each one of us can be doing to help with that anxiety. What should we be focused on, and what could we be doing to help ourselves and those around us?
It's a great question, Derek. So really, I sort of look at this sort of as three prongs. So for people who are out of work and furloughed, businesses that have closed, really it has a huge financial impact and stress on them. For those of us who have kids at home that are doing remote learning, and then for our kids who are home from colleges or study abroad, it's keeping them engaged in a different way. And then just this whole idea of limiting social impact or social distance from each other has a really significant impact. And so really sort of from a financial standpoint, there are great resources that are out there in terms of unemployment benefits with the stimulus package. I would sort of say to those who are furloughed to really reach out to their HR to see what resources are available. I think for kids specifically, keeping a routine is really important. It decreases stress. We know this as parents that it's important to have those routines. And to give ourselves as parents kind of the break and saying, this is all uncharted territory for us, and that we're not going to get it right just out of the gate. And remote learning is a learned skill set. There's different technology needs, and there's different pace of learning needs along with that. And so again, just giving yourself permission that it doesn't have to be perfect right out of the gate. And then lastly, really from that social isolation, which is, I think, perhaps the most challenging for us as a society, right? Human beings are social creatures. Yeah. We deal with communities, and to have this limitation is really, really hard. So acknowledging the hardness of it, I think, is important. I think the second thing is to really get onto those platforms, whether it's FaceTime or WhatsApp or Zoom meetings, and being creative and thinking outside of the box on how do you either have a cooking class together or a book club that's virtual, or even just getting together for a social hour, I think are really important things that we can be very proactive to help decrease that stress level. I think from a self-care standpoint, I think it's important to think about, exercise, whatever that is, in your backyard, throwing a Frisbee, jumping on a trampoline, walking around the block, meditation, and doing those sort of mind-relaxing activities, I think are also really, really important in helping us along that self-care continuum.
You're a medical doctor. You also run a healthcare company. So you sit at an interesting intersection of exactly what's happening with this pandemic, the intersection of a health imperative as well as an economic imperative. How should people be approaching their own healthcare during this time?
Yeah, so I would say that a couple of things. Number one, I probably am the world's biggest advocate for preventive health measures, and to doing annual wellness and age-appropriate screening are really, really paramount for maintaining health. I would also be the first one to say that at this point in time, that because they are preventive measures, it is a time for us to put a pause on those until we are at a better place as a medical community. So reschedule your mammogram, reschedule your annual exam for 3 to 4 months from now, but put it on the calendar so it gets done. For those who have chronic health conditions, diabetes, high blood pressure, hypercholesterolemia, it's really important to continue your health care. There's just a different venue on which you are going to do that with us in the medical community. So we want to keep you safe by not bringing you into the office if at all possible. And we want to stay safe so that we, as the physicians in the medical community, can be there for, God forbid, the time that we have to take care of people in hospitals. So virtual visits, telemedicine, every single healthcare provider in this state are providing those now. So I'm going to encourage every single patient to reach out to whoever their provider is and to find out what options are available to them. The nice thing about the federal government is that they've really relaxed many, if not all, of the restrictions on telehealth visits. So picking up the phone, having a telephone visit, having a virtual face-to-face visit. There's lots of home equipment that one can use to help you to help me. So blood pressure cuffs, home blood pressure monitoring, glucose monitoring, so that I can interface with you to give you the care that you need, but keeping you safe at the same time. And then lastly, if you do need to come in to see us, most institutions now have screening temperature checks on the way in. Don't be alarmed at that. It's a way to sort of keep you as well as the other patients in the waiting room safe. You'll see that most of us are wearing masks, most if not all of the time at this point. Again, it's to help us stay safe, to protect you so that we don't give you anything and that we're healthy so that we can come to work to continue to care for you.
One of the important things that you do with your business, Steward Healthcare, is supporting employers and helping them to support employees. What can employers and employees be doing during this pandemic to support each other?
So I would start with saying that it's important to be honest if you're not feeling well. If you have a temperature, it's really important to stay home. I think there's been a culture in America of coming to work sick and
powering
right now,
through it.
Right, exactly. I don't think now is the time to actually do that for many, many reasons. So if you have a fever, stay home. It's important. If you have a cough, you need to mask up if you are afebrile and check in with your HR person before you even enter the building. You have an impact on others around you that may have a very large ripple effect that is important, especially now. I think that it is imperative from an employer standpoint that HR gets out information on a daily and timely basis about what's going on, not only in that business, but information coming out down the pipeline in terms of enhanced benefits. What happens if I have to self-quarantine? What happens if I get COVID-19? What are the processes and protocols that I need to go through as an employee to be able to come back to the workforce? I think are really important, and employers right now are struggling to stand those policies and procedures up in this rapidly evolving environment. But I would say it's really important to do that on both sides of the table. We are not used to this idea of social distancing. And so it's important to keep that at top of mind as you are working alongside with people and to be thoughtful about that. Again, hygiene, hygiene, hygiene. That copious hand washing is really, really critical. And as I say to people all the time, wash your hands like you were going into heart surgery. So it's that extra attention to detail that I think is really important. And then lastly, I would say that now is the time, sort of above any other time in the history of industry, to be creative, to say, how do we remotely work in a way that's collaborative, working in teams on sort of the software platforms that are out there like Microsoft Teams to be able to collaborate, but do it in a way that allows us to continue to do our jobs. I think the last thing is to be kind to one another in the work environment. This is really hard. And I think that we tend to dismiss that and to use your words, power through. And I think recognizing that there are challenges with this social distancing and the barriers of working remotely and that social isolation, I think checking in with one another, I think is important. Reaching out and with great ideas on, hey, what if we did it this way? I think now, sort of above any other time, is a time to be super creative.
Thank you for the insightful and practical guidance that each one of us can use, whether it's at home, with our families, with our friends, and in the workplace. Thank you, Dr. Milavetz, for joining us on today's Task Force 10.
Thank you.